discharge. How you doing?
I'm doing good. How are you doing tonight?
Good. I have a great assignment, thank you. But I have one patient who I think is going to be really high acuity and may need help tonight.
Oh yeah? I tried to make your load pretty easy tonight. What's going on?
Oh, he's the one with the hemorrhagic stroke that came in last night. A little bit worried about him because he was on warfarin too, so blood thinner, so he was at a huge risk. I believe it looks like, yeah, he's in room 7. He had severe toxicity of the brain cells because of that loss of blood flow that was happening to his brain, and I think it was on the left side.
Oh.
So I'm noticing that he's probably going to have that right-sided weakness.
Yeah, oh, wow. Roughly only 15% of strokes are hemorrhagic strokes and the rest are ischemic strokes.
Yeah, it's pretty rare. I know, looks like I'm gonna have to do a neurological assessment heading in. Yeah, the anticoagulant therapy that he was on, he was also pretty hypertensive before, but because he was on the medication, it looked like he was monitoring his own vitals at the time, which was good. I know when you're on the warfarin, you bleed out really quickly, so they monitored that well. He had a cerebral aneurysm, it looks like. The doctor believes the stroke was subarachnoid hemorrhage, which is probably one of the more common strokes for the hemorrhage stroke. It's that subarachnoid in the brain of the Willis center.
Oh wow, I didn't know it was that serious.
Yeah, thankfully he was monitoring his vitals. The family was with them. They noticed the Cushing's triad because he was monitoring his vitals. He was really hypertensive all of a sudden. He had irregular breathing, and the whole Cushing's triad thing. And his heart rate was really bradycardia. But he had that extreme headache that really set him off and started vomiting. That's that common with the subarachnoid hemorrhage. And the family noticed immediately fast symptoms of the face and arm droop that was happening. And they got him in an ambulance within 15 minutes of noticing all these symptoms, so that was great, yeah.
Wow, thank goodness, because a hematoma or large clot could have quickly, usually within 24 hours post-stroke, causing severe anoxic encephalopathy.
Yeah, anoxic encephalopathy is like, could have happened. I'm not sure if it did. Well, I'll have to read the notes when I get in. But yeah, we're really worried about that. The cerebral edema and the pressure on the spine. And luckily, probably that none of that happened because he's in great health right now. It seems like we'll just monitor him tonight, and I'll just do maintenance meds and neural assessment. Thank you.
All right, everybody's in good hands.
Awesome. My name is Jacob. I'm your nurse today. How are you feeling? Good. So I'm just going to do some education with you about the stroke that you had last night. Do you remember any of it? Okay, yeah, I know you were a little out and that headache was bothersome, but no headache right now? Okay, good. So last night it looks like, I'm just going to check all my notes while I'm talking, okay? You came in, and excuse me if I'm just repeating information. Hi, my name's Jacob.
Hi, it's me.
You're the wife, right?
Yes,
Okay.
Ashlyn.
Ashlyn, okay. So you came in last night, you had the hemorrhagic stroke. All that means is that you had an aneurysm in your brain, and the aneurysm broke. And so there was a rupture in one of your vessels, and you had some swelling of the brain, basically. So what we had to do last night was we went in and we did what's called and let me get it right. It's a endoscopic hematoma evacuation, because hematoma is a blood clot that can happen in the brain, and we usually do this, and it's just a small hole that they drill into your brain. That's that shaped part of your head right now, and that allows the doctor to just kind of scope out, make sure no major blood clots are forming, because you can't really cure a hemorrhagic stroke surgically. Basically, your body just clots it on its own, and we just want to make sure there's no excess clotting happening. Also, you had that aneurysm, so what we do is an endovascular therapy just to prevent any kind of other aneurysm. So they'll put a coil in. For you, they just did a little clip, and that just makes sure that vessel won't rupture again and no new aneurysms will form. Are you feeling any weakness right now? Yeah, that right side, that's common. So you had your stroke right on the left side of your brain, so that right side, you're going to notice some mild weakness, but you got really lucky. Hemorrhagic strokes usually have like a 40% mortality rate. Because you came in so quickly, it looks like they were able to just stop the swelling, make sure there was not much of brain damage, and that you'll hopefully restore to be able to get up and walk. But before you get up, make sure that you're letting us know, because that weakness, we don't want you to fall, and especially with the medications that you're on right now. Do you have any questions?
Is there anything that we should be watching for right now?
Yeah, so right now the reason why he's here is we're just monitoring his vitals. We're going to be monitoring his blood levels to make sure there's no blood loss, his H&H and his CBC values, which is just a basic blood test for us. Because really that 30-day period is when the mortality rate goes up because a new stroke can happen.
Okay.
So we're just going to be monitoring his vitals. Right now he's on a liter of oxygen. I know he's on oxygen at home, we just noticed his saturation was a little low. So for that moment, we're on that. Let me see if there's anything else I have to tell you. Yeah, so we're pausing the warfarin treatment right now.
Okay.
I know he just started that.
Why is that?
Because it's a blood thinner, he's more likely to start bleeding.
Okay.
So we don't want any of that bleeding. Last night he came in for a CT scan, which is their usual diagnostic treatment for the stroke, and they just noticed a little bit of blood on the brain.
Okay.
So exactly. And I told you we gave you some of that hypertonic solution that reduced that cerebral edema that you had. I don't think there's anything else, but I'm going to begin the neural and musculoskeletal centered assessment. It's a head-to-toe assessment, but I'm going to be really focusing on that neurological system and that musculoskeletal system just to evaluate your weakness currently and where we go in the therapy process, okay? Awesome, thank you. Mike, can you shrug your shoulders for me? Push against my hand, push against my hand. Can you grab my fingers? Excellent. Now push up, push down. Yeah, I'm noticing a little bit of weakness on that right side, so we're just gonna watch his gait when he gets up. Can you push up on the feet? Awesome. Push up, wiggle the toes. Excellent, Mike. I'm so glad you don't have any kind of hemiplegia. You look great. Excellent. So we're gonna be just doing a full neuro assessment. I'm not going to ask you to get up or do any kind of movement for me because I just don't want any kind of falls until PT comes and evaluates you, okay? Awesome. So I'm going to begin that neuro assessment now. Thank you. All right, and I'm going to finish with the head-to-toe assessment right after. To the Stroke Show. This is where we talk about correct nursing actions for preparing for strokes. So today's subject is hemorrhagic stroke, and our contestants are Angelo and Ashlyn. Okay, for our first question, a nurse is working a shift in the emergency department. An 81-year-old man is brought in and has confirmed to be experiencing a hemorrhagic stroke. Which order should the nurse question? A. Give potassium replacement. B. Swallow study completed by speech pathologist before eating. C. Give 2.5% dextrose at 100 milliliters per hour. Or D. CT scan. What's the correct answer?
C. Give 2.5% dextrose at 100 milliliters an hour.
Excellent. Yeah, dextrose is a hypotonic solution. This causes the cells to swell and it would increase intracranial pressure. This should never be given to a patient with ICP, as it would make the pressure greater. All right, next question. Angelo, you got to catch up. What risk factors should be managed to reduce the risk of hemorrhagic stroke? A. Atrial fibrillation. Yes.
Sorry. Did you catch me?
No, go.
Okay.
If you know the answer, tell me.
I think it's hypertension.
Excellent. Yeah. So the correct answer is hypertension. It was A. Atrial fibrillation, B. Heart rate, or D. Blood clot risk. But hypertension at C is correct. Our number one risk of hemorrhagic stroke is hypertension. It's also part of the Cushing's triad. So whenever you see a stroke coming, if there's a Cushing triad present, you could be suffering from a hemorrhagic stroke. All right, question 3. A patient in the emergency department is complaining of left-sided weakness and is diagnosed with cerebral hemorrhagic stroke. Which of the patient's current medications is important to let the emergency physician know? A. Multivitamin. B. Furosemide for hypertension. C. Omeprazole. Or D. Coumadin for atrial fibrillation.
D. Coumadin.
Excellent. Coumadin, it's a blood thinner. Excess bleeding, we don't want Coumadin if the patient had hemorrhagic stroke because they can completely bleed through and that intracranial pressure can build up like crazy. All right, for our last question, Ashlyn in the lead. Which of the following may be used for the treatment of hemorrhagic stroke? A. Blood pressure reduction to less than 150 milligrams per mercury. B. Clot buster. C. RTPA. D. Is cerebral edema. IV mannitol. E. Anticoagulant. It's 2 answers.
Okay, maybe blood pressure reduction and IV mannitol.
Excellent.
If there's a cerebral edema.
That's correct, and that's that same hypotonic solution that we need. Excellent, guys. So Ashlyn's a big winner. Have a great day. This has been our NCLEX questions for This is a Stroke.